My name is Dr. Victoria Ngozi Ogbuji. I'm the anchor of Grace on Telehealth. Good morning, good afternoon, good evening, depending on your location and wherever you're watching from. Today, I am here to talk about a very common topic. A topic that is part of every family, a topic that is part of every community, a topic that is part of every society, and that is smoking and the risk to my health and your health. Remember, we're here to talk about me, to talk about I and you. In the context of this telehealth today, we're talking about cigarette smoking, its risks to our health. When we talk about smoking or cigarette smoking, the first intuition is the person that goes like this, that pops it in and out. But no, the person that pops it in and out is rather researched so that the person that does the risk smoking is safer than the person that is inhaling the smoke. And that is called secondhand smoking. That is why you need to listen. You need to pay attention. When you are, in a public space where people are smoking, know that you are smoking too. You have your child, you have your children in a public space where people are smoking. Know that your 1 month old, 1 year old, that your teen is smoking. It's called secondhand smoking. That is why it is important that you listen. And know that wherever you go and they're smoking and you're not a smoker, you walk away or excuse the person to go to a different place, to smoke. That's why most places you see them put some signatures. Smoking is not allowed here. It's just to protect the community, to protect the society. So, why is smoking a health risk? Yes, it's a health risk because it does not just cause cancer. Smoking affects your heart. It affects the entire system. Mind you, it's affecting the oxygen, and the blood carries the oxygen from the head to the toe. So, it affects the oxygenation of the blood, okay? So, it affects the vessels that carry the blood. That way it causes poor circulation, it causes respiratory problems and many more issues. So it's a canker one. So what are the risks? What make people have the urge to smoke? Because if you don't have the urge, you don't smoke. And if you have not started smoking, don't start it. It's not fun because it's better to start certain habits than to end it. So the research shows that our children, the teenagers, are at high risk to start smoking for several reasons. Curiosity. Remember, they said there is a saying that says curiosity kills the cat. Exactly. So they want to try it. They've seen, adults puffing in and out, and they're curious. They want to feel it. They want to get that sensation. They are curious. And when they start and they feel good about it, they're going to start hiding to, start doing it. That is why you have to keep an eye when your children get into the teen age. Again, when they start, getting involved into sports, mind you, they still start mingling with other children from different backgrounds. Maybe they already started testing or started smoking because an adult in their home smokes. So they'll be like, oh, you want to just try it. It feels good. And when they try it, it helps them to feel, have the sense of belonging, and sometimes to feel hard, to feel they are grown, So this is a warning to parents. Please keep an eye and be a friend to your child. Mostly when they start getting into the teen age, I know teens say from 13, but when they get from 10, 11, 12, when they start joining to play certain sports, okay? And then social factors, your friends, that even happens to adults and young adults. Your friend is smoking and you be like, nah, just try this. And you want to belong, you try it. While living in certain neighborhoods, a lot of people around there smoke, so you want to try it. Or but I want to tell you today, it's not one of those things you want to try. Smoking is not a good habit. It's not your friend. It's not a friend to your health. People that are already having that habit, they think it's pleasurable, but in their hearts of heart, they're trying to quit. So do not join. Okay. So the kind of now I'm going back to parents. The kind of shows, television shows, what your children watch in the social media influence them a lot to forming certain habits, and one of them is smoking. It's like I'm focusing so much on children, young adult teens, yes. Because if we're able to catch them young and prevent them from smoking, I bet you will have less adults that smoke. If we're able to make them understand why they are still young, the risk of smoking, the health risk, the impacts, the negative impact of smoking, if we're able to make them understand why they are young, even the Bible says it, train up a child in a way he should grow. When he grows up, that he will not depart from it. So we parents, we have a lot of work to do. This is a societal commitment to reducing cigarette smoking and the effects of secondhand smoking to innocent populace. So we have a lot of work to do. So for our schools, for our teachers, for those that form the education curriculum, I recommend as a societal benefit to think about teaching our children the health risks of cigarette smoking. It is very important. And for those of us that teach in Sunday schools, in religious organizations that have the opportunity to reach out to the teens, to the children and all that, I think it would be good to include it in what we teach these children. If you're a parent and you smoke, you know it is not healthy. While you're battling with your own habits, please, it will be very, very beneficial to your children to let them understand that it's not a good habit. Even though that you're smoking, that you're trying to quit, it's good to, put in the positive thoughts about health in them. And one of it is telling them that smoking is dangerous to their health. If you have any recommendations, if you have any comments or any questions, please do put it down in the comment section. And if you like what you heard, remember to follow my page at Grace on Telehealth. My name remains Dr. Victoria Ngozi Ogbuji. Thank you.